as promised, let's adjust the camera properly. Yep. So who is online? Like I earlier said yesterday, I'm going to be coming live by 2 p.m. So here I am because yesterday after I finished shooting, I was a little bit exhausted and my battery was going down. So I could not stay longer online. I saw a lot of questions, so I personally could not take them. Like I promised yesterday, I was going to come live today to take as much questions as I can, depending on how many people are going to ask their questions and also who are those that are going to be online. So that is why I'm here today to take your questions as promised. So if you can hear me, just drop on the comment section that you can hear me. And if you are watching this live stream for the first time, my name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. So that is what I do. So if you have any question, drop on the comment section. If you are watching, you can hear me, also drop on the comment section and tell me where you are watching from. Hello everyone, I'm back again. Alex, thank you very much. You are always in my life. Thank you. I really appreciate it. I think I owe you something. Welcome, Nurse Miss Mary. Thank you. Abigail Olabisi Oladipo. I can hear you, ma'am. Thank you very much. Thank you very much. Before the question starts coming up, I just watched something on Facebook and I would like to share with you, and I would like to also know your thoughts about it. Then we have Nibatu and Toho from Liberia. Thank you very much for watching. I'm saying hello from UK. Okafor Miracle, hi, good afternoon. Good afternoon, how are you doing? And hope you are doing great. If you're watching this live, just click on the live button. If you would like to join my live, if you have something to say, you have questions to ask, and you would like to join the live, just let me know. In my next live video, I'm going to be inviting you there. We're going to be talking about, we are here to talk about sex and reproductive health and everything in regards to your health. So if you want to join my live stream, so we can have a conversation, just let me know. You can send me a message on my Instagram page. You can send me a message on my Instagram page. So on my next live, I'm going to send you the link. Then we'll go live together. All right. So we have Charles Kimbabwe, Charles from Uganda. Thank you very much for watching. Thank you for all those that have clicked the like button. Past stitches. Oh, are you going to stitch my scrub for me? Just let me know if you're going to be stitching some nice scrub for me. Past stitches. He said, I can hear you, ma, and streaming for the first time from Lasso. Hello, and how are you doing? How is Lasso? And hope you are doing great. So Joe Sands Media, are you going to give us some media sounds? What are you going to do for Nurses Lecture Room? Joe from Kenya following. Thank you very much. Okafor Miracle, my first time watching you, and I am watching from Italy, and I also have a lot of questions to ask. All right, Okafor Miracle, I am here to take as much questions as possible today. So just drop your questions as they keep coming. I'll be taking them one at a time. And if you're watching, don't forget to click on the like button. Don't forget to also share this live video with your friends. Okay, so before I came on live on this live video, I was on Facebook just going through some videos while waiting for 2 p.m. and I saw a video of someone cooking placenta. We all know what placenta is. I saw a video of someone cooking placenta. I think the person grilled it, dried it, blended it. I don't know what that person was using it for. And I've heard about it, people cooking and eating their child's placenta. I would like to know, what is your take on it when it comes to cooking and eating or frying or spicing up the placenta and eating? For me personally, it's a no-no. Sorry, it's a no-no. No matter the health benefits or whatsoever they say about how nutritious the placenta is, for me it's a no-no. I can't eat the placenta. All right. So if you can eat it, if you like it, if it's your culture, you can drop on the comment section. I would also like to learn from you, and also why you like to have a taste of a placenta. And if you've had a taste of a placenta, what's your take on it? All right. I have Ivan. Hi, sister. How are you doing? So the questions can start dropping now. The questions can start dropping now, and I'm going to be taking it one at a time. All right. The questions can start dropping now. Please click on the like button. Put user timeout, hide user on this channel, add a moderator. Who wants to join? Do you want to ask a question? Do you want us to have a one-on-one conversation on the live? Just let me know. So Okafor Miracle said, let's read Okafor's question. You can read to me with me. My first question is, can a woman that is fat get pregnant? A woman that weighs 140, can she get pregnant? Is it 140 kg? As far the woman is ovulating, be it fat, slim, as far the woman is ovulating, she's seeing her menses, she can get pregnant. All right? She can get pregnant. But being obese, being extremely fat might put you at a risk, you understand, of some medical condition. But no matter the weight, no matter the size, as far the woman is ovulating, she's releasing egg regularly, she's seeing her menses regularly, she had sex, and there was ejaculation and sperm went into her vagina, definitely she's going to get pregnant. So that is not something you should be worried about. So we have Progress Gemma watching from Nigeria. Your teachings on health has been the best so far. Thank you, Jamal, for that wonderful comment. Okafor's second question. I want to start with the first because I have a lot of questions from my friends and loved ones. So hold on, I have a lot of questions. Just keep dropping it. I'll answer as much as I can. Other people can also drop theirs, not just Okafor. Pastor says, do you have idea of the effect on the intake of the placenta? I have not really studied about it, but I think I should study about it and make a video on it. I really want to know the effect, if it has any nutritional benefits, if it has, I really want to know, but personally, I don't know for the now. See, I go about and study it, and I'll come back and give you my feedback about the intake of placenta. Then we have Ketura Victoria Scout. I see yellow discharge thing. I'm trying to get pregnant. Yellow discharge, it's creamy. Yellow discharge might be normal. You get? If it's not smelly, it's not itchy, you're not having temperature, it's not something you should be worried about. You get? But if these discharge are smelly, they are itching, then it's time for you to see the doctor and get the necessary check done. In general, what I advise, what I say to the public is that having discharge as a woman is normal. All women are bound to have discharges. But when it now deviates from what you usually see, when it now has this foul smell, it's smelling different, it's itching, it's causing discomfort, you're having cottage cheese discharge, these are the things that will make you to see the doctor. But just know that discharges from the vagina, that's a normal thing. But if these discharges start causing discomfort, then it is time for you to speak with your doctor. All right? Then I'm seeing yellow discharge, and I think I'm trying to get pregnant. If you are trying to get pregnant, first of all, lovemaking is important. Your spouse has to be around. Track your ovulation cycle. If you're having a regular cycle, track your ovulation date and have sex. Definitely something might show up in a month's time. But for women with PCOS that are having irregular cycle, I have made a video on how to conceive with PCOS and irregular cycle. Hopefully the video will be dropping this week. I'm just waiting for my video editor to do some touch up in the video, and I'm going to be uploading it soon. All right. So Victoria Scout said, please, I am watching from Sierra Leone, help me with medication. See, I can't really prescribe medications over the phone. The best thing I usually advise is for you to speak with your doctor, and they give you useful medications depending on what is being diagnosed. All right. Is it discharge smelling? Is it cottage cheese? These are the questions. They're going to take history from you, and that's going to determine the medication. If they're going to be giving you some antibiotics, some antifungal, anti-candidal, and all that. All right. Please, can you explain Progress German? Okay, I think Progress German said, please, can you explain the reason for irregular period in a teenager? Is it because of PCOS? I am curious. Um, Progress German, if you are watching, let me know you are watching because I want to explain this in details. And also, when you say teenager, does it mean that this teenager just started seeing her menses? Has she just started seeing her menses? Because this is kind of a question I get regularly. So, Progress Gemma, tell me, how old is this teenager? When did the teenager start seeing the menses? All right, so we can know how to do it. Because sometimes it's not PCOS, it's just the teenager's body trying to balance the hormone and get ready for proper ovulation and menses. Right? Just give me a proper history and I'll see what I can say about it. Okafor Miracle say, for the obese, for the excess weight, what can she do to reduce the weight? More weight, because she has tried everything and it's not working. When it comes to she has tried everything and it's not working, when it comes to reducing weight, one of the things that is very important is what she take in. What is she taking in? What type of food is she eating? Okay, what type of food is she taking? There are a lot of diets on a lot. I'm not a nutritionist per se, so I can't really talk about weight gain, exercise. But what I advise is that she should cut down on her calories. Those um how will I put it down? How do I say that now? She should cut down on her calories. Like take more of vegetables, take more of fruits. Okay, instead of taking a lot of processed food, a lot of chocolates, a lot of biscuits, a lot of should I say snacks, things like that. She should focus more on getting a lot of vegetables, a lot of fruits. I made a video about how I was able to go back to this same me after pregnancy because personally, I don't like fat. I have my target kg. So personally, if I am going above my target kg, I try as much as possible to work on it to go back to where I am. Then if I go below my target kg, I try as much as possible to work on it to go back to as far I am not underweight, it is fine by me. So I made a video about weight loss. She can take some tips from there and add it to hers. All right. She's 20 years old and started her menses around 13. Okay. When you say it's been irregular, how many days interval? You get, because this, for me to make a proper assumption, I have to know what is happening. How many days does she see this menses? Is it every 15 days, every 20, sorry, every 30 days, every 40 days, every 50 days? We can't just say it's PCOS because PCOS is not the only cause of irregular cycle. There are different causes of irregular cycle. Every 32 days is normal. If she sees her cycle every 32 days and it comes every 32 days, that is perfectly fine. Okay, but if she see her cycle something like, okay, this month, when, okay, it's like I'm too fast. Let me answer Progress Gemma slowly. I'm too fast. Mercy, take a deep breath and answer them slowly. Okay, let me tell you something. When you see your menses every 28 days, maybe this month you see 28, next month you see 29. You understand? The other month you see 27. It is a regular cycle. If you see your cycle every 32 days, it is a regular cycle. It is not irregular. When we say a cycle is irregular, it is when this month you see your cycle 30 days. Next month you see it 28 days. The other month you see it maybe 20, maybe let's say there's always like 9 days, 7 to 9 days interval. 28 days, the other one you see 35 days. You count again is now 26 days. From 35 days is now 26 days. From 26 days is now 40 days. So when you see such a discrepancy between your cycle, that is when irregular cycle comes in. All right, so 32 days, as far as regular, it's constant. Every 32 days, this particular girl sees her menses. It is regular. I don't know if I am making sense to Progress Gemma. Alex said your teachings are very simple to understand. Thank you. I'm glad you're understanding. Ezekiel, during intercourse and he comes fast, what should be done? Okay, I have made a video already on erectile dysfunction. Yeah, when you talk about coming fast, that is more or less like erectile dysfunction. This person is having erectile issues. So I've made a video on how to tackle it. This particular video is going to be dropping this week, hopefully this week on latest next week. So just stay tuned. Turn on the notification button so you can watch the full video in details and apply it. Definitely is going to help you. All right. Okafor Miracle said, okay, sorry, before I go back to Okafor Miracle, let me talk about Progress Gemma. He said, but her menses stopped for 4 months. Please, if her menses stopped for 4 months, you've done a pregnancy test and this person is not pregnant, see your doctor. Yeah. Yeah, just see your doctor for proper examination. Progress Gemma. 4 months is a long duration. You get 4 months is a long duration. So if you've seen your menses and stopped for 4 months, then speak with your doctor for proper examination, please. Okay, Gemma Progress, I don't know if I'm making sense, but try as much as possible to speak with your doctor. I don't want to miss any question. Okay, Okafor Miracle says, for me, I have a question, my personal question. I had miscarriage last year and it has been a year now. I have not been pregnant again. I don't know why. Can you tell me why? Okay, generally, miscarriage, we cannot say miscarriage is a cause of infertility. No. You had a miscarriage. That doesn't mean you cannot give birth again. Having a miscarriage does not mean you are not going to give birth. You're not going to put to birth again. So what I would advise you is for you to ask yourself this question. Am I seeing my menses every month? If you are seeing your menses every month, that gives you a clue that you are ovulating every month. And if you are ovulating every month, all you need to do is to track your ovulation day and have sex on that day and see what happens in the next 30 days. All right. But generally, you can take you can do your pregnancy test 2 to 3 weeks after sex to confirm if you are pregnant or not. Or you can wait till when you miss your menses to do a pregnancy test. Okay. Progress German, please speak with a doctor. All right. Then Okafor Miracle says, and also before my period is always 4 days and 5 days. Now it has changed to 2 days, 3 days. And also he do stop and start today, tomorrow, stop, next tomorrow, start. Okay, Okafor Miracle, 2 days cycle is usually normal. You get, some ladies have 2 days. They see their menses for 2 days. It's normal. Some ladies see their menses for 5 days. It is normal. But since yours was 4 days and 5 days, but now it's later coming to 2 days, maybe you should speak with your doctor. Basically, but as one age, your age also affects how your menses is going to come up too. So you should take that into consideration. So maybe you can speak with your doctor if you have any personal concern. But aging, as one ages, your menstrual cycle changes. They start doing something. They might go less, they might go high. So if you are worried and concerned, I can do a personal diagnosis here and give you a personal treatment. But what I would advise, if you are concerned, you can speak with your doctor, especially now that you're trying to get pregnant. Okay? Abua Yabo, I have varicocele. What should I do? I'm planning to make a video on varicocele. It's going to be out next week. So Abua Yabo, I'm just going to screenshot your comments and I'll make a video personally for you. So what you just need to do for me is to turn on the notification button in case the video on varicocele pop up. You're able to watch it and get a wonderful idea about it. So varicocele is a broad topic. If I really want to do it, I have to know what I'm saying before I dish it out. So just give me some time. Abwa Yabo, I'm going to be making a video for you. Just make sure you stay tuned to our channel so that when this video pops up, just know it's for you. And definitely you're going to watch it to get useful insight. So Rejoice Ogbona says, my friend have been having serious discharge after measles. What could be the cause? When you say serious discharge, what do you mean? What is the color of the discharge? Is it causing discomfort? Is it itchy? Is it cottage cheese? Is it smelling? These are the things we have to take note of. Sometimes that discharge might be a bacterial infection. That discharge might be a fungal infection. So depending on the type of discharge, that depends on the treatment your plan, your doctor or your healthcare provider is going to give you. All right. So what kind of discharge? I've made a video, Rejoice Ogbona, I've made a video talking about discharges and what they signify on our YouTube channel. Is there different type of discharges, what they signifies, what the different smells in discharges signifies. So when you watch this video, it's going to give you an insight to know, okay, what is really wrong. So what you just need to do is to compare the video that have been made on the various type of discharge with what your friend is passing through. And that gives you an insight on how to go about it. Okay, so Miley's official says, my urine test shows that I have Escherichia coli infection. Can sex lead to this infection and what should I do? After a laboratory test, it's advisable for you to speak with your doctor. So they give you some medications to help you fight it. Am I making sense? Sorry. Oh, I'm trying to get something. All right. So when you get a urine test, fine, it shows Escherichia coli. So your doctor has to prescribe some medications to help with the bacteria. It can be treated. So don't be scared. It can be treated. All right. Past stitches. I think I've answered your questions, but you were not online. Past stitches. Where is it? You can type the question again because I've answered all the questions. Okay. You asked about the intake of placenta, right? And I said, I don't really know, but I'm planning to make a video about that if the placenta actually have any health benefits. All right. Charles, I didn't see your question. Just drop your questions now so that I can take it. Past stitches and Charles, drop your questions so that I can take it. Okafor Miracle said, I don't know how to calculate my cycle, please. Okay, to make it easy, Okafor, I made a video on how to calculate your cycle. All right, because if I want to explain it now, I don't have a board to explain it. So go and search for our video on how to calculate your cycle, settle down, watch it, and get back to me. Okay? Yahaya Ganiyat, I didn't get your questions. Past stitches, I didn't get your question. Charles, I've not gotten your questions. Do me the favor of typing the question again. Ademi, hi my love, happy to be here. Happy to see you, Ademi 999. Rejoice Ogbona, answer my question. Rejoice, I've answered all the questions on that has been popping. You can retype again. I have not seen it past stitches. I haven't seen your question. Mills official. You say, I'm scared of the Escherichia coli because I have rashes around my manhood and the lab tells me it's only the E. coli infection I have. I still want to know if the E. coli infection can cause rashes. Does E. coli infection cause rashes? E. coli. Okay. So I don't tell you what I don't know. What I can promise you is that I'm going to screenshot this and make a video for you in regards to E. coli infection. But E. coli infection can be treated. Just get some medications. I think, yeah, it can be treated. So just get some medications and get it treated from your doctor. So it's not something you should be scared of. If you hear of HIV, hepatitis, hey, you might be skeptical, you might be scared and worried. But E. coli can easily be treated, okay? Progress Gemma said, does using tampons have any serious side effects? In terms of tampons, I don't know about any serious side effects of using tampons. I've not heard about it. The only side effect of tampons I've come in contact with, but it's very rare, is people leaving the tampons in the vagina, not taking it out. Yeah, that can cause infection. So, for example, you put your tampons and you forgot to remove it. That is one of the serious side effects. And I believe as a lady, you don't want to forget it. All right? Kafo said, the last time I went to see my doctor, he said I have no problem, that I should go and lose some weight. So, what will I do? Because I want to have my baby. So, the best thing I would advise you to do is to try and see what you can do when it comes to weight loss, exercise, your food intake. When you want something, you have to be dedicated and disciplined to get it. And one thing I would advise you, work on the food intake. I know it can be tempting. You have a lot of food. You have all the food going through your eyes, the pounded yam. You want to eat it. You want to eat. You just have to be disciplined when it comes to food and also exercise and see the outcome. Like I earlier said, I've made a video on how I was able to lose some kg. Not that I was fat before, but I just try as much as possible to maintain my regular and normal weight. So I've made a video on how I lost some few kg after delivery. So you can watch it and see. Past teacher said, what is the effect of postinol? In terms of the effect of postinol, there is no direct effect of using postinol, but there's something I want you to know. Postinol is an emergency contraceptive. It is used in an emergency situation where it is not planned for. It's not something you should take regularly, because when you continuously take postinol too, definitely your cycle is going to be affected. You're going to be having irregular cycle when you continuously take postinol too. So postinol, it's just a post pill. That's why if you notice, they call it emergency contraceptive. It's not what you should take every time you have sex, please. Though you check Google and Google tells you, oh, there's no side effect, there's no this, please and please don't abuse postinol. Charles said, what are the best ways of preventing pregnancy without using emergency contraceptives or withdrawing method? It's hard. Okay, the best way to prevent pregnancy, one is the use of condoms. Yeah, if you don't want to use emergency contraceptive, you use condom. That's number one. Number two, if after unprotected sex, you don't want to use emergency pill, the next one is to immediately take IUD, intrauterine device. You get? So intrauterine device is a family planning method. So when you use that, it helps to prevent pregnancy. Let me share this thing with you guys. You know, people are like, oh, I had sex 3 days ago. You understand? People say, I had sex 3 days ago and I forgot to take postinol too. What can I do? I really want to prevent pregnancy. Another option is to use the IUD. That's the intrauterine device. Because this intrauterine device, when you insert it, it helps to prevent pregnancy up to 5 days after unprotected sex. So that is the way I know. You can opt for a family planning method. Charles Kimbabwe, opt for a family planning method. That's going to go a long way to help. Okay. Then it takes time to stand again after the second round. Okay, I understand what you're trying to say. When it comes to standing up again after the second round, it depends on both parties. That is your partner. You get, if you want to stand up again after a second round, what I advise, take a rest, go slowly again from the beginning, let the romance be intensified. You get, go slowly, romance intensively, and see how it goes again. Because generally, it's usually difficult to go again. So forget people that tell you, I go 10 rounds, I go 15 rounds, I go 20 rounds. If you can go one round and your partner is satisfied, I think that is fine. Okay? Sex is not and also outside the penetrative sex is not standing up again. Outside the penetrative sex, why don't you explore other options when it comes to sexual intercourse? You don't have to explore just penetrative sex. You have to explore other options with your partners. I think having a conversation with your woman is going to go a long way to help. Because sex is not all about you, it's not all about the woman, it's about two parties, what they want. Do they have the strength to go again? Do they want to really go again? Things like that. All right? Diamond weight loss. What is a woman? Yeah. I think this question is broader than you think. What is a woman? Okay, Diamond question. Do you really want me to answer this question? What is a woman? Do you really want me to answer it? Okay, I will answer it from my own perspective and from the way the world is turning into. Okay, a woman generally, for me, it's a person that has a vagina. Yeah, for me, it's a person that has a vagina, and that is it. That's just the simple terms in which the external feature shows. You know what I mean? The external feature shows. But today, it's not like that. What the world seems now, the way the world is turning into, they tell you a woman is what you say you are. I don't know how to put it, because these days a man can just wake up and say, I don't like to be a man, I want to be a woman. And some society don't see it as a big deal. But for my own culture, being a Christian, a woman is a woman like me, and she has a vagina. For a woman to be called a woman, she has to have a vagina. I don't know if I'm making sense to you, but for the way the world sees it now, a woman is who they tell you they are, be it presence or absence of a vagina. I think that's the height, that's the least, that's the way I can answer these questions now. Okay, diamond waist loss. Thank God, it's really a big question, because these days you can't say this is a woman, because we've had situations where you are walking on the streets, you're walking at home, you're walking, and you see somebody and you say she. Facially looking, this person look like a she, but this person don't want you to address her as a she, but she wants you to address her as a him. We are in a society where, for example, I am a girl. I don't want you to address me as a girl. I don't want you to address me as a boy. I want you to address me as them. It's like it's changing. It's not like it used to be. But I am a Christian, and for me as a Christian, and from my own religion, from my own culture back home, is that a man is a man and a woman is a woman. Presence, absence of a vagina, presence, absence of um of a penis. Yeah. But there's also what we call hermaphrodites. Hermaphrodites have both the male and the female genitalia. You see, it's rare, it's not rare, it's in existence. Okay? I think that's all I can say. Okay, then the other one said, Progress Gemma, please, I really want to know the cause of heavy clotting during period. If the blood clot is heavy, it's not small. It's normal to have small blood clots. If it is heavy, please speak with your doctor. Yeah, it could be as a result of a lot of things that is wrong with the female reproductive organs. You might be having issues. If you are having heavy clotting during periods, speak with your doctor for maybe some scans, some examinations to really know if it's something for you to be worried about. It is normal to have clots in your menses, but if it becomes heavy and is too much, please speak with your doctor. Can I get pregnant from someone else's bath water? I don't know about that. It's gonna be rare. It's gonna be rare. It's gonna be difficult. I've not heard about that, so I don't think it's gonna be rare. Maybe 1 in 1 million women gets pregnant in someone else's bath water. There might be a thin chance. Maybe the sperm was swimming in the water and it swims into the vagina, but it's rare. I don't think it's there. If I hear of anything, I will come and share. You get. Past teacher says IUD cannot it fail. IUD is 99% effective. There is no method of contraceptive that is 100% effective. But IUD is 99, so it's okay. But no method of contraceptive is 100% effective. Yes, IUD can fail, but it's 99% effective. All right? Past teachers, I've answered your question. Hope you're online. Ezine Amarachuku said, I just noticed I have breast discharge. You notice you have breast discharge. Did you press it? Did you stimulate it to come? Or when you are just sitting down or when you're doing something, you just see the breast discharge rushing from it? How is this breast discharge looking? Because sometimes some of this breast discharge is not something you should be worried about. I had an opportunity to invite a breast surgeon over on the YouTube channel where she talked about breast discharge, and she was like, sometimes these discharges are not something you should be worried about. You don't have to stimulate your breast, you don't have to press it to get. If you are pressing it, you might be the one stimulating it. All right. So how does this discharge look like? Is it causing any issues? And Chidi says, hi, I want twins or triplets baby. How to get, please tell me. Telugu or English. You want to get twins or triplets. In terms of getting twins or triplets, I think for a better option, the first thing is to have sex. That's one. The second thing is to speak to your doctors. After a proper examination, they will give you some medications that can stimulate your ovaries to release more egg. That's also a way to try to get twins or triplets, because generally your ovaries are expected to release one egg every month. So when you take these medications given by your doctor, it might stimulate your ovaries to release more eggs, thereby making you give birth, thereby increasing your chances of giving birth to twins or triplets. Okay, if you are damn serious about getting twins or triplets, speak with your doctor and let them guide you through. Know your menstrual cycle, because your doctor is going to ask you what is your cycle, because that's going to tell you what date you have to take the medications and when the egg is going to be released. Okay. Okay, somebody asks, Progress German, what can a pregnant woman do to prevent vaginal tear during labor? This is a video I really want to shoot, and it helped me. Let me click on it. I think somebody asked this question on my comment section before. I just screenshot it, but I'm going to give you a tip. One of it that you should do to prevent vaginal tear, one is exercise. Exercising your perineal area is going to go a long way to help. Like during my pregnancy period, personally, I delivered through vaginal delivery. Yeah. And I had a very big baby. As small as I am, I had a very big baby. So exercise is very important. Perineal massage. There's what we call perineal massage. I'm going to make a full video on it explaining what perineal massage is all about. Because perineum, I think the person that asked this question has to be online. Progress German, if you're online, let me know. Okay, I think he's online. I think Progress German is online. Okay, let me answer it. You see, I said one is exercise. One is exercise, German. The second one is perineal massage. You see, perineum is a place between the vaginal and the anus. The area, that space between the vaginal and the anus. So you have to massage it regularly. So when you are massaging it daily, it's preparing for the baby to come out. So that helps a lot. And when it comes to perineal massage, you as a woman might not be able to do it very well. So your partner, which is your spouse, you might tell them to help you out, especially when it's close to you and your third trimester. It's close to your delivery date. So doing that perineal massage every day, maybe morning and evening, is going to go a long way to make that area prepared. But I'm going to be making a full video on how to prevent vaginal tear during delivery. Okay. I'll be leaving here by 3 o'clock because I'm going to Facebook. I'll be stopping my live by 3 p.m. because I'm going to my Facebook page, because I told them I'm going to be doing live, though I don't have a lot of followers on Facebook. So if I don't answer your question here on YouTube by 3 p.m., kindly meet me up on my Facebook page. Let's talk. All right? Meet me up on my Facebook page. We can talk and we can take your questions. Let's see. I'll be very happy to see this number of people, these 16 people that are watching now on my Facebook. Please support my Facebook page, so I'll be there. by 3 p.m. I'll be very excited to see you all on my Facebook page. All right, let's continue. At least for those that are having plenty questions now, I'm unable to reach. When you come to my Facebook page, it's not going to be a lot like that, so you can easily answer your question there. I've answered that. Can I get pregnant on the Sabbath day? If you are ovulating on the Sabbath day, you have sex on the Sabbath day, then fine, you can get pregnant on the Sabbath day. Diamond weight loss. James said, please, my doubt, tell me any people, please. Chinny, I don't understand your question. How do I get a job in the UK now? Udo. Depend on your job description. What do you do? You get, if you are a nurse, there are processes on becoming a nurse in the UK, the IELTS, the CBT exams, the job application or track jobs. Everything takes process and everything takes time. I am not an immigrant. I'm not in my immigration consultant. I don't know much about immigration. I only know about nurses and how they are able to migrate to the UK, because I actually migrated to the UK as a nurse. So I have a video on that. If you are a nurse, that's the only advice I can give about nurses migrating to the UK. So what you can do, you can check my YouTube channel on how to become a UK registered nurse. So that's what I know. I don't know about other occupations. What treatment is best for serious discharge after measles? So when you say serious discharge, what do you mean? Because serious discharge is a different ball game entirely. Like I earlier said, discharges are normal. I keep saying it. Discharges are normal. All right. When you say serious discharge, what I would advise, so that when I come live, you'll be able to know what to ask, is that I have a video that explains different type of discharges and what they signifies and what can be used to sort them out. If it's antibiotics, if it's antifungal, if it's anti-candidal and things like that. So what I would advise, watch my video on the types of discharge, the various smell of discharge, what they signifies. So that's going to give you an insight. For those that have been asking me about discharges, discharge is normal. But if it shows some particular signs, some particular smell, then it's something of concern. That is why you should watch that videos on the various discharges on my YouTube channel. Okay? Okay, past teacher said, how long does it take for the egg to fertilize the sperm? It's very quick. Within 24 hours, the whole thing is done. Because your egg, when your egg is released, your egg has a lifespan of 24 hours. That is just one day. Just one day. So after that 24 hours, the egg is gone. All right. So within 24 hours, fertilization that takes place, the things is already done. So the lifespan of an egg is 24 hours. While the lifespan of a sperm, the highest is 5 days. Yeah. Past teacher says, what causes squirting in women? Squirting is normal. But the fact is, it's not all women that squirt. Some women get to orgasm but don't squirt. Some women squirt and have orgasm. There are some women that have never squirt or have orgasm. It's all different. So squirting is a normal thing. It's more or less like a urine coming out from a urethra during sexual intercourse. I've made a video on squirting. You can watch our video past stitches about squirting. All right. Progress Gemma said, I love the way you answer everyone's question. Thanks, my favorite nurse. Thank you very much. It's a privilege having to answer your questions. Please, Progress Gemma, past teachers, all of you, kindly join me on my Facebook Live by 3 p.m. It will be an interesting section, having my YouTube fans on my Facebook page. Just say hi, say wave, do some waving to me on Facebook page too. All right. Mary God Star TV sending love. Thank you very much. What's your Facebook page? Thank you. Just go to Facebook, type Nurses Lecture Room. Our page is Nurses Lecture Room everywhere. Nurses Lecture Room. That is the name of our Facebook page. Nurses Lecture Room. Just the same name we are bearing on YouTube. That's the same name we are bearing on Facebook, on IG, and all of our social media handle. Okay. Merit Ugochi said, whenever I think of the Labor Day, fear grip me. Please encourage me. Okay, Merit, I have experience. I'm not just a midwife. I have personally experienced childbirth, and I know how it looks like. Trust me. Um, Childbirth, that is during that hours of the whole contraction of the whole pain, it's actually very difficult. But immediately you hear the cry of your baby, trust me, all the pain you've been feeling is gone. Yeah. One thing is that, one thing I will advise you, if you can hear me, what's her name? Who asked the question? I'm coming. Ugochi. One thing I will advise you about labor is that everything you are doing generally, have a positive mindset. Say to yourself, people have gone to the labor room and they're out. They were able to do it. I will be able to do it. That's one thing. Like, have this positive mindset. Always see yourself welcoming your baby. Always see yourself having your baby in your arms. All right? Always, like, look at your stomach, look at your tummy and say something good. Speak to your baby, speak life into your baby. Like, communicate with your baby as much as you can, as if this baby is already in your hands. As if this baby, you've already welcomed this baby. But when the contraction come, it might be challenging, it might be like frustrating. Also, get someone, your spouse might be there with you. That's going to make things much easy. You'll be able to put all the annoyance on him. It's just it. It is what it is. So just get someone. It could be your mom, it could be your partner. Just make sure you have someone to lean on during that whole process. But it's going to be painful. But have it at the back of your mind that while you are pushing, you get that at the end, when the baby comes, everything is going to be settled. You're not going to even think about the pain anymore. You're not going to be thinking about, you will just be laughing. I remember after having my baby on my arms, I didn't even think about the pain down there. I didn't even think about anything again. I was just super excited seeing her. Like, I was extremely grateful. So, see the positive side of things. Speak life into your baby. Communicate with your baby. Just have a positive mindset. Having a positive mindset is very important. All right. Don't think about the negative things you've been seeing on social media, because we have a lot of people dying in during labor, a lot of people losing their baby. And close your eyes to those things. If you see what my mind was going through, like, why am I saying it? Like, when your mind going through a lot of things, during that period, you will watch a video, you see a baby has some deformity. You're like, God, my baby will not have things like that will just clap your head. Like, that's me. I don't know about you. That's when you start seeing funny video of kids having deformities. I'm telling you what happened to me. So you know, like, start getting scared. But immediately such things come into my way. When I see children with deformities, like, what I do is that during that period, when they ask for donations, I donate some little amount to them. You get, because I know for that mother it's not easy. But during that process, I was also praying for the one in my womb not to have something like that. So pregnancy is a challenging journey, but one thing I advise generally is to stay positive and always see the positive side of things. You get, see the positive side of things and don't see the negative side of things to go chi. You're going to be a mother and you're going to carry your child and you're going to be joyful. That's something you should take note of. Labor is not easy, but the joy that comes after it cannot be measured. Is it normal to sometimes feel pain in the nipple area? Yeah, it is normal, especially during your ovulation period and during your menses. So things like that can pop up. If it pops up, if you notice that at a particular time of the month, it comes and go, that it is normal. It's as a result of your cycle, the hormones and things like that. All right. But also take note of the fact that you have to be doing some breast examination. In case there are any early signs of cancer, you should be able to meet your doctor for proper examination. All right. It is normal. But if you are concerned, speak with your doctor. Will I be able to finish this? Like I earlier said, I only have 9 minutes now. So I might not be able to finish all the questions, but I'll be going live by 3 p.m. on my Facebook page. Nurses Lecture Room on all social media. I think on our Facebook page we have 20 something thousand followers, so we can go there and we'll continue from here, because I already said I was coming live. um so let's see. I don't want to miss any questions. I'm going one after a time. Ugochi, I've answered your question. Will you gift us past stitches? Today I'll look for a particular day where I will come live and do some gifting and some bonus. I've done it several times on my Facebook page. I've done lots of alerts, 5,000 recharge card. I've done that on my Facebook page, so I might do that soon. I will think of a day to do that, and that's going to be my top followers on Facebook. I'm going to do that because on YouTube, you can't really get your top followers, your top subscribers, or things like that. It's only Facebook. So I've been doing that on my Facebook page, and I tend to continue doing it. All right. So definitely, the top followers, top subscribers are going to get something as usual on the Facebook page. I usually do that. Just check, you see it on my Facebook. Is I think, okay, is it normal to feel pain in the nip? I've done so that. I'm 24 days cycle length. I saw my period on the 7th of November. What is my ovulation date? Faith or more, your ovulation date is going to be day 10. Yeah, your ovulation date, if you are sure of your cycle, your ovulation date is likely going to be day 10 of your menstrual cycle. All right. Adidna Tijani Jr. Please, what food should I eat to increase my libido level and stamina during sexual intercourse? I think that's a topic I need to make a video on. I need to find out more food. But I've heard a lot about bananas, dates, that they are good when it comes to increasing they are is it aphrodisiac they call it. I heard about bananas. Sorry. Okay, it's not my daughter. So I've heard a lot about bananas. I've heard a lot about dates, that they are good in increasing staminas and libidos generally. But I think I will have to research more and make a lot of videos in regards to that. But one thing that helps to increase sexual activity that I'm sure of is you personally being sexually attracted to your partner. Trust me. If you are sexually attracted to your partner, as far both of you are together, you always want to have sex. But I'll make a video on the food very soon. Soon. And Progress Gemma, what is the cause of watery clear discharge after measles? It can be normal. As far as it's not itching, it's not smelling, it's not causing any discomfort. It's not something you should be worried about. Progress Gemma. Past teacher said, what is the difference between squirting and orgasm? I've made a video on that, explaining the difference between squirting and orgasm. So squirting, there's release of urine. Know your pee. The squirting is coming out from the urethra, your clitoris. You understand? I don't know how to explain, but I've explained it on a particular video. In squirting, there is a release of piss, urine. Yeah, but orgasm doesn't have to be. There's a release of urine also. That's one of the major difference. What is your Facebook page? Please, my Facebook page is Nurses Lecture Room. In 5 minutes time, I'll be going live there. I plan to spend 1 hour here and 1 hour on my Facebook page. So by 3 p.m. sharp, I'll be going to my Facebook page. Okay, I don't want to be self-centered, coming to YouTube alone. So please and please, if those that are online on YouTube can join me on my Facebook live, I'll be super excited and I'll be grateful, because we want to increase the reach on our Facebook page and also increase the engagement on our Facebook page. All right. Faith I've answered your question. Your ovulation day is day 10. My Facebook page is Nurses Lecture Room. All right. Akopa TV Official. Please, I am 28 days cycle, but now it has changed this month. I had it 3 days after the normal 28 late, and I don't understand. See, it's just 3 days late. So if it's just like 3 days, it's not something you should be worried about. Sometimes stress can affect your menstrual cycle. Yeah, when you are stressed out, you are sick, you are taking some medications, it can actually affect your menses. For example, you have malaria and you're taking some anti-malaria medications, you're taking some antibiotics. I've noticed it personally, that can actually affect your measles. So 3 days late is not something you should be worried about. At least you saw it. That shows that you're not pregnant and you are fine. Okay? So that's that Akopa TV official. Merit Ugochi, thank you, ma. I'm glad I was able to help you, and I wish you a safe delivery. I wish you a safe delivery, and I'm telling you congratulations in advance because I know you're gonna deliver joyfully, and we're gonna dance. We're gonna dance. We're gonna dance. All right. Is there any question? I think I've answered basically all the question. Is it normal to still feel pain after the first day of your period? Yeah, it's a normal thing. Some ladies have pain for the first 2 days. It's usually as a result of the uterus contracting, the endometrium contracting. But there's also a but. If the pain if the pain intensifies and it's becoming so discomforting, it's advisable you see your doctor. Sometimes endometriosis and some other things might be the cause of some painful messes you are experiencing. Please, we have a lot of people coming in on this live, but not a lot of you have clicked on the like button. So what I would advise, just click on the like button. I have 3 minutes to go. I'll be going to my Facebook page to do the live. So click on the like button before I go. Click on the like button before I go. Click on the like button before I go. And before I go off, because I know most of you will be joining me on my Facebook Live. So before I go off, I just want to say something because I've gotten a lot of DM from people, and this is just a general advice. You have just one life to live. Try as much as possible to be happy. Try as much as possible to take care of yourself. Try as much as possible to be contented with what you have. All right? Because in life, you can't get everything. I've come to realize that when you get 1,000 naira that you're looking for, when you get that 1,000, you want 2,000. When you get 2,000, you're looking for 10,000. Human wants are insatiable. Human wants are insatiable. I don't know why I'm saying this, but I just want to let you know that human wants are insatiable. So whatsoever stage you are in life, as a man, as a woman, be happy. I know everybody wants to be greater, everybody wants a lift, everybody wants to be higher. But whatsoever stage you are, be happy. And what you should use to compare, it's good to compare, make comparison. I'm not saying make comparison with your friends, make comparison with your siblings, make comparison with people, make comparison with where you are coming from. You get, make comparison with your past and see which is better, and see the growth you have accumulated over time, right? Because what is killing us generally is we comparing our growth, our life with other people. The better we stop comparing our life, our growth, our successes with other people, the better for us. We have just one life to live. Be happy and pray for growth and work towards growth. You're going to experience a lot of challenges. You're going to experience a lot of difficulties. You're going to be experiencing a lot of things on the way. But trust God, and I believe you're going to be happy. So it's 3 p.m. Please, for all those that are here, join me on my Facebook Live and say hello before you go on my Facebook Live. Let me know that all my followers on YouTube have come to say hello on my Facebook page. So I'm going live on my Facebook right away. I'll just have some sips of water and I'll be live on my Facebook page. Thank you all for joining my live, and it's a great privilege to take your questions. I am super excited that you could ask me questions and I could provide reasonable answers to you all. Thank you very much and see you in my Facebook Live. Bye. Click on the like button. Let's make it 20. Sorry. It's not up to 20 like. Just one person. Click on the like button before I go. Click on the like button before I go. Make it 20 before I go, please. I just need one person to like this live before I go. Make it 20, please. Please, just make it 20. Ah, they're going, they're not even making it 20. It's not nice. Just make this live video 20 likes. Who is liking? I still have 10 people waiting. Why don't you click on the like button and make it 20? All right, they don't want to make it 20, but I wanted them to make it 20. It's not nice. We had a lot of people coming and most of them did not read. Okay, thank you very much once again. I know it's going to complete 20. Let me just go and wait for the 20 likes. All right, bye and see you on our Facebook Live now.